welcome to the webinar. My name is Baylor Rice. I'm a pharmacist at the South River location, as well as a clinical liaison for Revelation Pharmacy Corporation. So hopefully today you're expecting to hear about the gastrointestinal system, because that's what we're going to be talking about. So with that, I want to give a little bit of an overview for starting just a little bit on kind of a little bit about Revelation, so you can kind of understand it, because they do have a number of different pharmacies around the country. So you maybe have gotten an invite from Austin or Everwell, Pincol makers. As you can see, the list goes on, and they're adding more and more every month. So it's really kind of an umbrella, if you will, of local independent compounding pharmacies that have kind of come together to kind of pull together resources and expertise to really offer our patients the best in supplements, the best in consulting advice, as well as the best in compounded medications. So in case you're wondering why somebody from South River is talking to you today, and you may be at one of the other locations, that's why. But really, we're all kind of sisters, brothers under one big umbrella, if you will. So hopefully that kind of makes sense just a little bit. So, but we do, under Revelation, we do specialize in compounding. So that is the mixing of two or more ingredients to form a final product. And that could be anything from a capsule, cream, nasal spray, suppository, injectable, you name it. So compounding is the old art and of the profession of that, but we just use modern day technology and science to improve accuracy over time and safety for both our patients as well as those in the lab making the products. We also specialize in natural medicine, vitamins, minerals, herbals, homeopathics, etc. And that's kind of where we're going to be in today. We do offer personalized consultation, so you can get together with one of our pharmacists or consultants and go over your disease state and come up with a very specific game plan for your case. And so we do have those of us that are trained in functional medicine and natural integrative approaches to medicine. We do have a whole host of different testing that's available to us, from saliva, urine, hair analysis, stool analysis, looking at micronutrients, etc. And if you've had a hard time getting some different labs, blood labs, we do have a portal on our website that we have an agreement with Ulta Labs, so you can go onto that and really order any number of blood labs that you want. And that's generally on average at about an 83% discount off a typical retail. So it's a nice service that we've been able to do for our patients. So with that, we're going to go ahead and get into the meat of today's presentation. So talking about the gastrointestinal complaints, and certainly they are among the leading reasons that patients seek health care in America. So over 95 million Americans experience some kind of digestive problem, with this totally exceeding healthcare costs of about 40 billion annually. So that is a lot of issues, a lot of problems, and a lot of things that really are having a hard time being addressed. So to understand a little bit about the gastrointestinal tract, 70% of humans have GI symptoms or disease. But it's also interesting, about 70% of the immune system surrounds the gastrointestinal system. So very frequently we'll see that when the gut is off, we'll have an immune manifestation there from it. So you can see a variety of different clinical symptoms coming from it. So really getting that normalization of gut function can really help result in improved clinical outcomes across a whole host of disease states. And so really, this can affect digestion, mental function, joint health, immune function, respiratory function as well. And from the mental piece, so our neurotransmitters, right? Our norepinephrine, epinephrine, dopamine, serotonin, PEA, glutamate. The majority of those are produced in the gut. So if the gut's not healthy, that's why we'll see a lot of depression, mood, anxiety, a lot of neurotransmitter imbalance. So the cool thing is there, again, with that, we can actually look at that with a urine test. So digestion, of course, that begins in the mouth. We've got to chew our food. Chewing breaks down food into smaller bites and pieces so that the digestive tract can really, we have the secretions of pancreatic enzymes, the peristaltic action, really churning things up so that then things can get broken down and absorbed within the gastrointestinal system as things go through. So the esophagus, of course, is delivering the chewed food to the stomach. The stomach is providing the hydrochloric acid, breaking down the food and helping to also kill the pathogens. The pepsins help with digestion. Mucus helps protect the stomach wall. The gallbladder is secreting the bile to help break down the fats. The small intestine helps with that huge surface area that could cover that of a tennis court and exchange of nutrients and helping to break down the fats. And then the large intestine is helping with the reabsorption of the water and the ions and helping to form the feces and preparing that for certainly excretion. Most common lifestyle based causes of GERD. So GERD, gastroesophageal reflux disease. A lot of times that really is actually low stomach acid and not too much acid, but that can also come from food intolerance, also insufficient protein intake, as well as central obesity. So what happens, certainly the food comes in, sphincter closes here, you have the releasing of the acid, breaking down. So when that sphincter kind of opens, things go up. Well, what happens here where I say low stomach acid, if the acid is not strong enough, and pH, the strongest pH is going to be 1. So it's an inverse relationship. As the acidity gets stronger, that number gets lower versus going up. So alkaline is actually at 7 and very basic is at, or neutral's at 7 and very basic is at 14. So if this acid isn't strong enough, what happens is you keep secreting more acid. Well, if this sphincter is closed off, where is that going to go? That's going to go up. So a lot of times it's not really a product of overproduction in a way. If the acid was actually stronger, then you wouldn't have overproduction. The food would get broken down and then the sphincter would open and you'd have passing through the rest of the system. So that is one very simple test that we can do, is using some hydrochloric acid and seeing if that helps with that piece. But unfortunately, far often what is given are antacids or proton pump inhibitors to kind of decrease that acidity and help decrease the releasing of acid, but it's not really getting many times to the actual root cause of the problem. So symptoms of hypochlorhydria, which is low stomach acid, you can see a whole host of things, right? So you've got the reflux, the heartburn, but then certainly malnutrition, skin issues. So much of what I see with consulting is if the gut's not healthy, things aren't getting broken down. We don't have the absorption from the small intestines, large intestines that we need and the body's expecting. Then it can come out as that skin issues, rash, itching, hives, acne, etc. So a lot of times I'll start with the gut and work on trying to get that under control. Certainly constipation. Also, we can go to the other end of the spectrum with diarrhea. Certainly those are telltales, right? So, if you're having stomach pain, upset, reflux, constipation, diarrhea, ding dong, that's okay. Well, gee, I've got something going on with my gut. But there's a lot of these that can really kind of be silent, if you will, that most people don't associate with that. And one of which certainly I'll point out, osteoporosis, so bone health, right? If we're not absorbing the nutrients that we're intaking from both the food and or the supplements that we're ingesting, then that's not going to be helping with that bone density and protecting from the weakening over time as we get going. And I failed to mention this in the beginning. I'm sorry. And I do see one question pop in. There is a button should probably be more than likely, it's probably on the bottom of your screen, although I moved my toggle bar to the top of mine. It says Q&A. So if you do have a question, please type that in the Q&A section, and I will get to that. And since I'm mentioning that now, I'm going to go ahead and address this one here. Someone asked, would skin issues include plaque psoriasis? Yes. So with plaque psoriasis, many times I find certainly that does have an autoimmune component. So you have an inflammatory component, you've got an immune component, but we also have a gut component so often tied to that. So not only are we going to want to help decrease inflammation in the inflammatory process, support the immune system, but you are going to want to address the gut. Absolutely. So some causes of low stomach acid, certainly stress. Stress affects everything. If you want to hear more about stress, I think it was December, we had a webinar on that. So that is on the site. So you can go back and watch the previous webinars there. Certainly poor diet, eating too quickly, high sugar intake, zinc deficiency, things. Our stomach acid does decrease as we get older. So the aging factor, antacid medication and prescriptive drugs. So those H2 receptor antagonists and you know, your omeprazoles, your Nexiums, those sort of things don't help with hypochlorhydria. It actually makes it worse. Certainly food sensitivities, allergies, infections, chronic disease, chronic illness. So some things that we can do to that. One product that I use very frequently is called Spectrazyme Metagest. So Metagest does have a combination of betaine and pepsin in it. So generally what I'll do is start with one tablet, take it just right with the meal, see how you feel. If that doesn't do anything, then keep increasing it by one tablet until you have a slight burning sensation. Then once you start feeling that, then back off. So, you know, if one doesn't do it, then go to 2 tablets. If 2 doesn't do it, go to 3. If 3 doesn't do it, go to 4. If you've got a slight burning at 4, then you know, okay, I need to back down to 3. So then use 3 before each meal. Now, also, you need to kind of factor in a little bit on the complexity of the meal and the size of the meal. So typically, the more food you eat, the more of the betaine you're going to need to help break it down. Likewise, if you have a much smaller meal, then maybe where 3 you use for dinner, then maybe you get away with 1 with breakfast and maybe 2 with lunch. But again, you kind of play around with it. And hopefully as over time, we can help kind of balance that out. And so I find over time, we're able to kind of pull down off the Metagest and be able to decrease the betaine and pepsin. Zinlori 75 is a zinc carnosine preparation, and what this does is help heal the gut. So zinc does a fantastic job of healing. Typically 2 tablets a day do a fantastic job of helping against that heartburn, that reflux. There's over 20 published studies with using zinc carnosine. And again, typically 2 tablets a day does the trick, and you can see results in as little as 2 weeks. Typically, I'll have patients ask me, well, what if I'm on a proton pump inhibitor? What if I'm on something for it? I'll use the Zinlori along with it for 2 to 4 weeks, get you to a better place, and then work with your practitioner. If it is being prescribed, work with the practitioner. If you're just using something over the counter, then we'll start tapering off the other medication while maintaining on the Zinlori until things are resolved. Question came in, would rosacea be a skin issue? Also, absolutely, I would consider that a skin issue. How about overdose? If you'll follow up on that with regards to which product. Somebody typed in about overdose as well as any side effects. I don't see any side effects with Zinlori 75. Overdosing, certainly it is a zinc product. So if you're talking about the zinc, yes, certainly you could overdose with that. If you're talking about going back to the Metagest with the betaine, well, again, you're slowly increasing that up. I'm not going to have a patient start with 7 tablets. And I don't think I've ever had anybody start even need to get up to 7 tablets. Most of the time, you're going to be somewhere, 4, maybe 5 at the highest on that piece. Somebody did ask about zinc in general. Will any zinc do the trick for healing the mucosa? In this case, absolutely not. It is very specific form of zinc. Zinc carnosine is what you need, and that's where the studies have been done. So yes, so the question on the Metagest with the betaine, you increase the dosing up until you feel a slight burn, and then you back down. That's when you know, okay, I've hit the dosage that I need. All right. So great questions. So I'm gonna move on. I don't want to get too bogged down into questions. I'll try to keep an eye on that, but I may need to just get to questions at the end. Glutagenix. Glutagenix is a combination of deglycerinated licorice root, aloe, and it does a fantastic job of helping to heal up that mucosa. It's a powder. Generally, I'll use that along with some other medical foods. And this also has glutamine in it, which glutamine is one of the primary amino acids for gut health. So that's kind of a 1, 2, 3 punch, 1 having the deglycerinated licorice root in it, 2 having the aloe, and 3 having the glutamine. Can't say the flavor is absolutely fantastic on it because it's not, but it does work extremely well. Small intestines, really that's going to help with completing that digestive process and absorption of nutrients. So the mucus is going to protect that gut wall. As I mentioned earlier, huge surface area, and you've got 70% of the immune system surrounding the gut. So that's why we see so much of autoimmune disease, chronic disease, really kind of tying back to the gut and making sure we have a healthy gut. So then therefore we can have a healthy immune system. Leaky gut or intestinal hyperpermeability is when the lining of the small intestines is damaged. So everything in the small intestines is considered to be outside of your body. It is not until substances pass through the small intestines lining that they become part of your bloodstream. So a healthy small intestines keeps toxins and undigested food material out, while a leaky gut allows microbes, toxins, partially digested food, and other particles to pass through. So this is where we'll have a lot of sensitivities to foods, if you will, to where somebody may not have a quote unquote allergy to a food, but they'll have a sensitivity. Sure where we lost it. So leaky gut or intestinal hyperpermeability is when the lining of the small intestines is damaged. Everything in your intestines is considered to be outside part of the body. Let's see, come on. Yeah. So it's not until the substances pass through the intestinal lining that they become part of your bloodstream. So a healthy small intestines keeps out toxins, undigested food material. That leaky gut allows the microbes, toxins, partially digested foods to pass through. So when that's an issue, for instance, you've got allergies to food, right? Allergies here, I've got an absolute skin reaction. I've got shortness of breath. I can't breathe, right? So also we have these sensitivities. So when we have a sensitivity, what can be happening is the protein from the food leaks through that gut wall, hence leaky gut syndrome. And then it hits the mast cell, which is the master of the immune system piece, the moderator, if you will, rather. And then, so you've got that inflammatory response, right? You also have that immune response. So that's why helping to decrease leaky gut is so important, is because ultimately leaky gut's going to lead to an inflammatory response and also lead to an immune response. So we don't want either one of those. let's see, I've already hit the immune response. When foreign substances make it into the body, your immune system flags it, right? So we've got that invader, we've got the attack on, the immune system's overwhelmed, it's overworked, and you're getting that response. So very critical with especially autoimmune diseases. There are 105 different autoimmune diseases. I do believe I'm in that camp that does believe that long haul COVID is going to probably be number 106. So that'll come in at some point as well. And this kind of helps to further kind of illustrate with that kind of coming in, leaking in, and affecting that reaction and affecting the immune system, affecting the inflammatory response within the system. So ideally, when we have leaky gut, we want to pull out the key inflammatory foods, okay? So increased intestinal permeability has been associated with inflammatory conditions. So both food allergies, celiac disease, inflammatory bowel disease, irritable bowel syndrome, asthma, atopic dermatitis, fibromyalgia, chronic regional pain syndrome, autism, juvenile arthritis, heart failure, type 1 diabetes, liver disease, certainly the list goes on. Causes a leaky gut, certainly the inflammatory foods, processed foods, non-organic animal products, so the antibiotics killing off the good bacteria in our gut, the glycophosphates from Roundup and the other pesticides used, certainly very common with grains. It can break down that gut lining in 16 minutes. Absolutely amazing. Excessive alcohol. So 1 to 2 for most people, less for others. Certainly with 21% of the US binge drinking, that's going and just having a huge assault on the gastrointestinal system. Our NSAIDs, so non-steroidal anti-inflammatory diseases, have an impact on the gut and gut health. Certainly steroids, antacids, proton pump inhibitors I've mentioned earlier, as well as antibiotics. And a lot of times then you get the gut wall off and or you have the antibiotics, and then all of a sudden, next thing you know, you end up with yeast overgrowth that further complicates it even one step further. H. pylori, SIBO, hormonal imbalances, stress, all of these things have an impact on the gut. Vitamin D deficiency. Now, I'm a huge advocate of vitamin D. If you've heard any of my other webinars, you'll know, the blood normal is 30 to 100, but where is optimal? Optimal is between 60 to 80. So often I'll see patients and they are at 32 and they'll be told, oh, you're good. You're within normal. Well, that is not optimal. I want optimal. 60 to 80, especially if you've got autoimmune disease, and I'm going to go up closer to that 80 piece, certainly. And certainly brain injury or degeneration, traumatic brain injury. There again, that's further pulling in that gut-brain connection. It's absolutely huge. Dysbiosis certainly being that imbalance between beneficial and harmful species of bacteria in your gut. So dys meaning bad, ill, or abnormal. So, we want to maintain the good bacteria in our gut to be able to fight off the invaders and help keep inflammation at a minimal. Okay. So good bacteria helping with protecting the lining, helping against the microorganisms, helping with proper digestion of nutrients and nutrition and the vitamins and supplements and breaking down the protein. Otherwise, what are we seeing? We're seeing damage. We're seeing increase in toxins, increase in gas, weakening the immune system, increasing the inflammation, decreasing energy because our body's using the energy from the mast cells and the mitochondria to be able to fight these foreign invaders. Difficult beginning, certainly C-section babies, those that aren't breastfed, they haven't passed through the vaginal canal, getting the inoculation from the mother, from the host, to help with proper immune function. Antibiotics are going to impact it. Dietary influences, I've already spoken of part of that. To add on, certainly fiber, decreasing the processed, watching the gluten, Chronic stress, low stomach acid, certainly I think we've hit that. Alcohol, prescriptive medications, hormonal imbalances. We do an awful lot of hormone imbalance. I'm a huge advocate of bioidentical hormones. The key certainly is balance, right? It's not if a little is good, more is better. It's having balanced hormones, and that's true for sex hormones as well as adrenal hormones and thyroid hormones, as well as toxins. Conditions associated with leaky gut dysbiosis. I've hit on a number of these already, so I'm not inflammation of the brain, right? We need to settle that inflammation down, brain-gut connection. CFS, chronic fatigue syndrome, fibromyalgia, chronic pain, all the different mental health disorders. This is a lot, right? A lot of this, you don't think for gut. You think about, well, gee, if I'm having gas, bloating, diarrhea, constipation, reflux, then you think, okay, well, gee, maybe there's something going on with the gut. I find 50% of the time patients come in kind of asymptomatic. So they don't necessarily having a gut red flag going, hey, I'm off, right? So it's kind of peeling back that onion and figuring out what's going on. Obesity, certainly huge advocate. We've got to pull the fat mass off. The more fat we carry, the quicker we die. Plain and simple. I can't make it any easier than that. So even if it's just 5 pounds we need to lose, let's get that fat off. It's going to increase inflammation. It's going to increase triglyceride deposits in the fat cells. We're going to see decreased short chain of fatty acid production, which leads to decreased, satiety, which is that feeling of full, right? So that's why, well, gee, I'm eating, and that, again, gut brain connection is off. And just a side note, obese individuals are 2 to 3 times more likely to require hospitalization if they acquire COVID-19 versus non-obese. Malabsorption, when you have a compromised ability to take the nutrients from the food that you eat. This digestive problem can lead to symptoms such as bloating, diarrhea, as well as many other serious complications, including nutrient deficiencies, higher chance of infection, as well as bone fractures, right? We need to be getting the micronutrients and macronutrients out of the food, so helping with that bone density as we age. Ultimately, malabsorption is wasted money, right? Huge advocate of supplements. The baseline I look at is, therapeutic multi, fish oils, vitamin D with some K, as well as some cannabinoid CBD is kind of our baseline. And then from there, we'll build off of that. Well, if the gut isn't healthy, well, we're not totally throwing everything down the drain, but we're not getting the full benefit. So if you do have malabsorption, if your gut isn't where you are, you're not getting the full benefit. Okay. Neurotransmitters, I mentioned this already, about 90% of the neurotransmitters are going to be formed in the gut. So it's really kind of nicknamed the second brain. So we really need, it's so huge. So if you're having any sort of psychiatric issues, problems, etc., we need to be thinking about the gut. Certainly antibiotic use, there is link to that tied to diabetes, right? Because that's making the gut get off, and that's affecting satiety and everything else. And you can kind of see if you start kind of threading together all the kind of different tidbits from today as we go through, okay, well, it's a snowball that starts getting out of control. Right? Antacids, treating reflux with antacid medications, it lowers the amount of acid production, which further decreases the amount of acid present, decreasing digestion of the food, increasing the likelihood of reflux, and increasing the likelihood of dysbiosis, which is a major cause of leaky gut. So it's chasing the tail, right? That's why, okay, in functional medicine, we kind of take a step back and what's all functionally versus just putting a Band-Aid on an issue. So what can we do to really kind of address this leaky gut, dysbiosis, malabsorption? But it's really kind of, we refer to it inside as a 5R program. So remove. So we want to pull out the harmful substances and behaviors. We want to replace. So replacing the enzymes if needed, replacing the fiber. You know, we need at least 30 grams of fiber, prebiotics, probiotics, the nutrients, re-inoculating the gut, getting that good bacteria back to where we want it, repairing the gut. So if the lining is off, getting the omega-3 essential fatty acids, the zinc, the glutamine, the other micro as well as macronutrients, and then of course resolving that inflammation, decreasing that so we can really break that cycle. So part of that is modified Mediterranean style diet. I really kind of gravitate towards Mediterranean is where I gravitate towards. That's my baseline, if you will. And then from there, I'll skew off of it. So when we talk about healing the gut, working on the gut, I really utilize very frequently a modified elimination diet. So what does that mean? It's also an anti-inflammatory diet. So that's pulling out, I'll hit the highlights for you. It's pulling out some of the highlights, such as dairy. Okay, so we pull dairy out. So that's going to leave things like almond milk, coconut milk as alternatives. Okay, soy, we want to pull soy out. We want to pull beef, pork, mystery meats out. Generally, I'm going to pull eggs out while we're doing this as well. From the nut family, peanuts. Peanuts are one of the most pesticided nuts there are. So peanuts, peanut butter, that's going to leave you almond butter, cashew butter. There's certainly lots of other nut butters nowadays that you can use as an alternative for peanut butter. And mine 30 days. A lot of times we'll go 60 days and then reevaluate, see where we are. Okay. Other things we'll pull out from the fruits, orange juice. Most all other fruits tend to be fine. Now, if I'm not pulling out something that you say, well, gee, I know I'm allergic or I know I'm sensitive to this, common sense prevails, then for you, you need to keep that out. Okay. Gluten from grains. Gluten, especially if you have autoimmune disease, no gluten, period. None, zip, nada. Keep it out. It's increasing the inflammatory response and being an assault to the immune system. Nightshades, a lot of times I'll pull nightshades out. So that's going to be your peppers, green peppers, red peppers, things like that. Sugar equals inflammation. So we need to decrease Then generally I'm going to use, as far as a medical food, protein powder, I'll use one called Ultra GI Replenish. Works fantastic for helping to heal the gut. Once we've got that on board, then of course we'll pull the Phytonutrient Multi on board. That's a food-based multi as well, has methylated Bs on board. As far as probiotic, one of my first go-tos is our Probiotic Spectrum. It also has Saccharomyces boulardii in it, so you've got a little bit of pre as well as probiotic. Management of inflammation, certainly fish oils are going to help. Our SPMs, which are our ProResolving modulators, and then our CBD. So Boxley's Organic is one of the few CBDs that is certified organic. Enzymes, if we have insufficient enzymes or acid, then we're going to need to pull that in either as the Metagest or enzyme complex, enzyme caps, or if you're having an issue with certainly gluten, there's an enzyme, it's a DPB4 enzyme that helps break down that gluten molecule. Now, for those, again, I want to point out autoimmune, no gluten, period. That doesn't mean let me take enzymes to help break down the gluten and cheat. Autoimmune, nope. We just need to pull it out and keep it out. So this is what the Ultra GI Replenish looks like. It does have 150 calories in it. You've got 15 grams of protein. So a lot of times I'll use it as the replacement for breakfast while we're healing the gut. And then generally I'll use a second one later in the afternoon as an afternoon snack. So then a healthy lunch, a salad, grilled chicken, grilled fish, vinaigrette type oil with it, with maybe some nuts, some seeds, some other veggies. And then, so doing this for breakfast, having a healthy lunch, doing it again for a snack, and then healthy dinner. Very similar to lunch, right? The salad with the colors of the rainbow, okay? And some nuts and seeds. You'll notice this is certainly free of fructose, soy, non-GMO, low sugar added, and taste is actually pretty good. It's I've got chocolate on here because that's the one I gravitate to, but there's also vanilla too. So, which, and of course, if you're going to add some berries to it, then vanilla's works very good to accentuate that. And there's also medium chain triglycerides in there to help with the fat absorption. Just some research kind of showing you that there have been studies on the Ultra GI Replenish, and you can see as time goes on, the scores improve, GI symptoms decrease, so from baseline to 6 weeks later. So going from a score of 53 to 61, going from a score of 10 to 12, 12 to 14, 15 to 17, and then total overall 94 down. The control was 94, actually went up to 109. Probiotics, as with our supplements in general, I'm very picky with probiotics. We want to know the genetics of the probiotics. We want really ID guarantee on it. So where the strain comes from. And so because we know the different strains are going to hit different disease states. So we really kind of look and think about which one we're doing based on what you have going on. So our Probiotic Spectrum, great combination. Also, it's going to help break down lactose a little bit, which is pretty cool. GI health, immune health. Okay. Ultra Flora integrity. This one I'm going to pull in really when we have an issue with the tight junctions and really have leaky gut. I'll generally use this one for the first month, maybe two, and then slide back and pull in the Probiotic Spectrum. Okay, and this is really kind of showing you how pretreatment with the ultraflora integrity prevents the disruption of the clinical intestinal tight junctions, looking at human model intestinal epithelial cells, which is pretty cool when you expose it to oxidative stress. Ultraflora biome, again, we've got different formulations based on what's going on. So studies with this significantly reducing the number of pain days when take post colonoscopy, modulates the immune response to vaccinations, helping with seasonal allergies, helping with cognitive function. So really some very good data on this. Our Phytonutrient Multi, again, food-based multi, helping to protect the DNA ultimately is where we're going. Very rich antioxidants with methylated Bs, very specific because 50% of the population has what's called an MTHFR deficiency, to where you're not breaking down the folic acid and the B12 properly. So I go ahead and hedge my bet and just treat everybody as though they've got an MTHFR deficiency. SPMs, so those are pro-resolving modulators. So it's not just hitting inflammation where it starts, but it's really helping to bring homeostasis to the inflammatory process in general. For these, I'll use post-accident, I'll use kind of pre-accident, pre-surgery, post-surgery as well to kind of resolve things. I'll go anywhere from 1 to 4 capsules a day. So if it's right after something happened, I'll go ahead and do 2 soft gels 2 times a day until we're feeling better, and then just kind of back down. Some other things that we can do to help complement the immune system, especially if you've got that autoimmune component. SGS Cellular Protect, that does a very good job of helping natural antiviral, helps with inflammation, lung protection, derived from broccoli sprouts is where that comes. So that also helps kind of balance the really phase 1 as well as phase 2 detoxification pathways. So it helps to keep that in balance, which is why it works so for such a wide variety of forms of cancer. Magnesium glycinate, you really can't get proper vitamin D utilization without magnesium. And side note, 75% of Americans are deficient in magnesium. So glycinate is my favorite form, one of the best absorbed, easier on the gut. And also when you use that is take that at bedtime. Why? That can kind of help relax. So it can help with sleep. So getting the 2-for-1er. Iron flavonoid plus is a combination of a variety of different natural inflammatories from curcumin, has some hops extract in there, some ginger, helps with pain, inflammation. If we've got the stress response going on, cortisol support is our herbal Ayurvedic adaptogenic formula that helps to balance the adrenal response. So if the adrenals are low, it's going to help balance it up. If they're high, overreacting, it's going to help settle them down. Again, adaptogenic. Our active immune support really kind of formulated that specifically for COVID. However, utilize that for autoimmune disease. Does a very nice job. It's got quercetin and acetylcysteine, a little bit of zinc, some vitamin C, as well as a very specialized EGCG that is hitting viral load on that piece. So some other tools and tricks that we've got in our bag to kind of hit glutamine powder. So this is straight L-glutamine. Okay, so 1 scoop is going to give you 5,000 milligrams of L-glutamine. So if you're doing, for instance, the Ultra GI Replenish, you could add half a scoop of this in that and do that twice a day to get that glutamine level back up. Our South River DGL caps, this is going to have deglycerinated licorice root in it, fennel, marshmallow, as well as some aloe. Kind of similar, if you will, to the GI Glutaheal that I showed you earlier. That's a powder, so this is more a capsule form, so a little bit easier on the palate, if you will. Enzyme caps. So this formulation, I want to note, has ox bile in it. That's great if you've had your gallbladder removed. Gallbladder, as I mentioned earlier in today's presentation, helps with the formation of bile. So if you've had your gallbladder removed, you're not forming the bile, so you're having a harder time digesting fats. So this formula does an excellent job of breaking down fats and helping those that have that gas and the bloating, especially for those of you with gallbladder being removed. 1 to 3 caps about 10 to 15 minutes prior to a meal or snack. Now, why 1 to 3? So 1, think small meal or snack, 2, medium, 3, larger. Okay. Now, use that as a rule of thumb, but play around with it. If you find, hey, you know what, it doesn't matter what size meal, 3 does the trick. Hey, great, fantastic. You saved an extra couple of capsules at that dose. But some may find, you know what, I need at least 2. Maybe I even need to go to 4 for, wow, I'm having a big steak dinner over at your parents' house that night or something like that. Enzyme complex, a little bit different formulation, plant-based enzyme formula. Again, also 1 to 3. About 10 to 15 minutes. You generally want the enzymes before you eat, so that has a chance to break down. Whereas earlier I talked about with the Metagest, which has the betaine, HCl, pepsin. Okay, that's with the meal. Okay, that's as you're eating. Okay, whereas the enzymes you want in just prior to eating. Other supplements, certainly I mentioned this already, my everyday essentials for optimal health, our Phytonutrient Multi, pure omega fish oils, vitamin D3, 5,000 IUs with K2. Yes, I will go higher if we have labs. If you've got labs and you're low, then we'll push that. And we've got one that has 10,000 IUs with the K2. I like the K2. It helps with the absorption. It also helps with the absorption of the calcium really forming into the bones, and it helps keep the calcium out of the artery, so it helps against atherosclerosis. Boxley's organic CBD, I like about 25 milligrams as baseline. We can do that with tincture, gummies, soft gels, whatever you prefer. Personally, I go to the tincture. It's easy. You just kind of drop it right underneath the tongue, let it sit there for about a minute to optimize the absorption. But really, whichever you prefer, whatever's easiest. Stress, as I mentioned, and that's, side note, I think that's where most of us first see our first stress response, is when we're young in primary school and have that upset stomach prior to a test, or doing your first play or something like that. Stomach gets a little queasy. That's that gut-brain connection. That's the adrenals kicking in, right? So that's why the adrenals are so very important also with the gut, maintaining a healthy gut. So cortisol support, as I mentioned earlier, our adaptogenic formula, 1 twice a day. We can always add some extra L-theanine on top of that. L-theanine is an amino acid derived from the green tea leaf, does a great job of balancing 2 main neurochemicals, norepinephrine and epinephrine, but it also helps with balancing all the neurochemistry, the serotonin, GABA, PEA, glutamate, dopamine. Adrenal support, kind of similar to the cortisol support formula, but more kind of energy. It's more of a pusher, if you will. Certainly cortisol supports, I hate to say more mild, because I don't want you to think that's less potent, but the adrenal support hits energy a little bit harder. It's got some rhodiola in it. Tranquil, if we have stress, worry, if that's kind of the key with the adrenals, then I think our Tranquil formula. Certainly sleep, 8 hours straight, right? So if we're not getting 8 hours, we need to think what's affecting sleep, what's disrupting sleep. So our melatonin, CR5, is a biphasic melatonin. It releases some initially and then some, about 4 or 5 hours later. So at the kind of 2 to 3 a.m. mark. Our Boxley sleep gummies, that has a CBD, as well as CBN, which CBN is a specific cannabinoid that does wonderful for sleep. And then it also has a little bit of melatonin in it. So a great combination there. Joints, cartilage, to kind of keep that fluid going. Our joint complex is a combination of type 2 collagen protein with a hops extract. So it kind of hits inflammation as well as the cartilage at the same time. Quality, right? We want to utilize companies that are registered with the FDA, following good manufacturing practices, doing dissolution, disintegration, mass spectroscopy, liquid chromatography. So questions, how do I get started? I know we've got a number of question and answer in the queue on that, so please go ahead and type in your questions, and I'm going to start getting to those, back to those in just a moment. But where do I get started? Well, stop by, if you've got one of the Revelation locations close to you, stop by your local location. They can help you. If not, certainly if somebody's further away, you can shop online, go to southriverrx.com, click shop now. If you want to schedule a consultation with one of our consultants, you can email Allison. She's at patientcare@revcustomrx.com. We do those by phone, WebEx, Zoom, if you're local to where one of the consultants is, and certainly you can always do that in person as well. Certainly, if you don't mind taking some time, giving us a review on Yelp, Google, or Facebook, follow us on all the different social platforms. Do sign up for our newsletter. We're not going to sell your information. We're not going to spam you. We're going to keep you up to date. The next webinar is April 12th at 2 p.m. Eastern time. And that one is, we're going to be talking about women's health next month. So let me get to the questions and answers for everybody. And making sure I'm not missing anything in the chat. All right. So any side effects, depending, Miss Scott asked that, depending on what you're talking about. With regards to glutamine, very well tolerated. Now with glutamine, I will tell you a side effect on that. If you have high glutamate, now glutamate is a neurotransmitter. If you have high glutamate, I will not use glutamine because then we're going to see some excitation with it. So kind of get excited, hyperstimulated. So if you do use glutamine and have that as a side effect, then back off of it. We may want to do a urine neurotransmitter testing and see where your levels are. So what do one have to do after feeling the sensation? So I imagine you're talking about the sensation of using the betaine to try to help with that reflux. So it's kind of a burning sensation in the gut. So when you have that, then you back down. And if that happens at just one tablet, then Elsie, that's not your problem. Then we need to look elsewhere. Okay. I didn't get you on hyperacidity and PPIs. So, and didn't have a name with this one. So, probably about 75% of the patients that are treated with proton pump inhibitors and antacids are treated incorrectly. I'm sorry, but that's the fact. So they're treated as though they have too much acid, but really it's insufficient acidity of the acid you have. So then therefore the gut keeps producing more acid, but it's not a strong acid. So, when you're looking at, well, here's the gut, I'm going to draw it this way. Right? And you have the sphincter. So you eat food comes in, this sphincter blocks off. So acid's being produced, but it's not strong enough acid to break down the food. So you keep producing more and more and more. Well, eventually, where's it going to go? It's going to go up, right? But if the acid was stronger, if it was a higher pH acid, or in this case, a lower pH acid, closer to 1, then you're going to break down the food, the sphincter is going to open, and then you're going to finish digestion through the small intestines and then large intestines. So that's what I mean by that. So, people are prescribed the proton pump inhibitors and an acid to suppress the acid production, but really the root cause, if you think about it, for most of the people is the acid's not strong enough to break the food down. So you have to keep producing more, but it's not strong enough. Okay, so hopefully that clears that up. It's a concept most people don't realize. Most practitioners don't even realize it, right? And then that's why, when we mention this, it's like, oh my gosh, and then the light bulb kind of goes off on, ooh, wow, huh, makes sense. Let me try it. So it's an easy trial and error. Any refrigerated probiotics better than those on the shelves? So Laureen, that really goes to what we're treating. I have probiotics in my refrigerator, and I also have probiotics that are shelf stable on the shelf. I'm very picky about the manufacturers I use. I actually go and visit my manufacturers. I tour their facilities. I look at their SOPs. I look at their C of A's, so we know exactly what they are. So for instance, our Probiotic Spectrum, I have a company make that for us. We've done studies on it. When I get it in the pharmacy, it is at 110% label claim. We max it out. Okay. And we've done a study. Well, what about at room temperature? So at room temperature, our Probiotic Spectrum is only losing 1% over 30 days. It's 1 capsule a day. So you're going to go through 30 in 30 days. I'm not worried about that 1%. Now, ideally, keep it in the refrigerator. But if you're forgetting it, then, and I'm speaking very specifically about ours, okay, then I'd rather you lose that 1% and keep it next to your other supplements so you don't forget it. So, unfortunately, on your question, it depends. It depends on which one, because I use different probiotics for different disease states, different issues, okay? And Lord knows, a disclaimer I probably should have done at the beginning was, I'm going to try to hit an overview on things and try to open your mind and eyes up to some things. And it's going to be impossible to cover everything that I could potentially cover in an hour. it would almost be impossible to cover every probiotic, every strain, everything in the course of a week even. Okay. Question, why do we have to exclude eggs from the meal plan targeted nutrients? That's when I'm doing a modified elimination diet. So when I'm working on somebody that has gut issues, has immune issues, has autoimmune inflammatory issues, I'll pull eggs out. I'll pull all the other things. I'll do that modified elimination diet for a period of at least 30 days, maybe even 60, depending on the scenario. And then we'll add foods back in one at a time and seeing the reactivity to there. So for whatever reason, it just seems eggs one of the key triggers. Now, when we add them back, if we add normal eggs back and you have a reaction, you know, I have had the instance to where then we've added organic eggs back and that didn't have a reaction. So ultimately, my answer is organic, free range, period. Right. Anyway, that's what we ought to be eating. We need to decrease the assault to the immune system. We need to decrease the assault of the added toxins. Are these other GI supplements very effective? So Lydia, it kind of depends, again, what we're talking about. And I tried to hit on that just a little bit. A lot of times, quite honestly, most of our patients that are having leaky gut syndrome, you know, most of those need a consultation, right? Because it is so very specific. We need to go through and dive into exactly what you've got going on. And a lot of times, I mean, I'll take it all the way back to in utero, right? What did your parents eat? You know, how was their diet? You know, were you vaginal delivery? Were you C-section? Were you sick? Did you have lots of ear infections, et cetera, young? Yes, it can go back that far. So really making sure we get that done. So really, we're very successful working with our patients. We have great impact, great effects. Unfortunately, today, sometimes I know everybody with and this is where American medicine's gone wrong, right? It's very algorithmic. Okay, well, I have this problem, then, you know, if I have X and I do Y, right? If Y doesn't work, then we go over to Z. It's far more complex than that. So it's really getting the data and rolling up the sleeves. Any recommendation where to get the supplements? Absolutely. Go on to our website. It's right now it's under southriverrx.com. And then you'll click that, and that's really, we're working towards that being as the online shop for all of the Revelation stores. So we're getting there. It just takes a little bit of time of consolidation. Any supplement for arthritis? You asked me a loaded question there, Veronica. Good. Lots of different things. So depending what type of arthritis, again, I love CBD for decreasing inflammation. But if we've got osteoarthritis to where the joint's broken down, our joint complex works amazingly well. Most of the time, I'm going to see a difference in 30 days. Most other things we're talking about for osteoarthritis, I'm going to tell you 90 days before you evaluate it. With this one, most of my patients in 30 days are starting to see a difference. 1 tablet twice a day. And again, you can get that on our online store. If you want to just shoot Allison an email, if you want to give us a call, I'm all about easy. I like easy. So whatever we can do to keep your life easy. Are there side effects to the stress supplements listed? For the cortisol support, very well. Certainly, default answer if you're allergic to one of the ingredients. Now, with that being said, I work with our manufacturers. I'm very aware of sensitive patients. I'm very aware of sensitivities, not just allergies. So we have our supplements made as clean as possible. So very certainly, if you have an allergy sensitivity to one of the ingredients, then you could have a reaction. But otherwise, very well tolerated. The cortisol support, that's one of my main go-tos for adrenal function, 1 twice a day. If you've stress, anxiety, wow, I've got a lot of stress on my shoulders, which is affecting the function of the task at hand. The brain's kind of going, I'm feeling a little ADD-ish. I tell you what, pull in that L-theanine. I love L-theanine. Don't be afraid to slam that. 1 capsule up to 4 times a day, 200 milligrams. We also have as a great tasting chewable. So if you have a hard time chewing, or also for my pediatrics, very safe. I use it for kids down to 3. I use it for granny at 103. Another question, is there a supplement? Oh, I got that one already, sorry. I'm hypothyroid, should I cut out gluten? Well, Zaina, if you have an autoimmune, so if you're Hashimoto's or Graves', then the answer is yes. Okay, just because you're hypothyroid doesn't necessarily mean you need to cut out gluten. But if you have an autoimmune thyroid issue, the answer is absolutely yes. But still, I recommend to an awful lot of people, try pulling gluten out for 30 days and then adding it back and seeing what difference you see. It can be an eye-opener for a lot of people. I was recently, I guess, diagnosed, friend prescription D, now taking OTC dosage. Will the multi cause too much deabsorption? Sorry, I'm trying to decipher what somebody was trying to write in the question and answer. Will the multi cause too much? No, our vitamin D in the multi is designed to go on top of that. But ultimately, Laureen, have a vitamin D level drawn, right? It's a blood test. It's easy. And then you know where your level is. Question, any compensation? The webinars, as you know, we don't charge for the webinars. We really believe in educating our public, educating our practitioners. We work very closely with our practitioners, our patients, trying to get you to where you want to be and making a change in your life. For the consultations, with that scheduled, absolutely, there is a charge for that. The charges range depending on the consultant. They can be anywhere from $125 to $275 an hour, depending on the consultant. But I'd like to think it's, I've been doing this a very long time. In my 30 years, I only had one patient that balked at the charge and that I don't think anything was going to make that person happy. As you can tell, I go over a lot of information very fast. So in the consult, I'm not just sitting back with my feet on the desk, twiddling my thumbs. I'm going through trying to cover as much for you as I can and go as fast as I can so you can get your money's worth. Been dealing with GERD and on omeprazole for many years, was doing fine, then got COVID end of September and have been having problems since. Yeah, absolutely. COVID just throws a kinker into all sorts of things. Had endoscopy and didn't find anything. Could I have long haul COVID? Don't really want to be on omeprazole forever. Certainly you could have long haul COVID. I think, there's probably about 1,000 other questions I'd want to kind of answer and go down. But if you're still having some reflux on the omeprazole, then let's try the Metagest for you. Let's see how that does. Long haul COVID, we can compound something in the lab called low dose naltrexone. So that is working very well for our long haul COVID patients. So that would be an option for you. So you can reach out to any one of the Revelation stores and they can help you with that LDN prescription. Think I definitely need a consultation. Well, Cindy, we're here, happy to help you. Just reach out, let us know. Recently diagnosed with Parkinson's disease. Oh my goodness, Julie, I am so sorry. There's little information on supplementation. Where's a good place to start with supporting my digestive system while taking Cinemet? I'll tell you, Julie, I'm telling you this not to be self-serving, but reach out, email Allison, let's get a consult set up for you. Very familiar with Parkinson's. My uncle had Parkinson's. He's passed. My dad had Parkinson's. I take Parkinson's very serious. So not only am I very aware of it professionally, I'm very aware of it personally. It's a nasty disease. There's a lot we can do for you. I wish I had CBD available when my dad was here. So definitely slam your dose of CBD, put you on CoQ10, work on the gut. And also there's something we can compound in the lab for you called synapsin. Synapsin does fantastic with CBD, helping to decrease the neuroinflammation. Any supplements for allergies? Absolutely. I'm not sure when our allergy webinar is coming on, but Raphael, look at, we have a product called Aller 7 that has a variety of natural agents in it. Has some NAC, has some quercetin, has some vitamin C, a couple other things in it. Does a fantastic job of stabilizing the mast cells. So it helps. So it's non-drowsy, non-stimulatory, it's non-drying. It does a fantastic job, anywhere from 1 to 6 tablets. And what I like about that is, man, if you're into the throes of the pollen, which our pollen's coming out here in Virginia, then you can slam it. But, if things back off and you don't need it, then, get away with 1 a day. Works very well. So Aller 7. Any supplement for eyes. What's interesting, Jarvis, is our Phytonutrient Multi there. Again, I'm going to go back to that. A very popular eye formulation called A-Reds, put out by Bios and Lom, A-Reds 2. Our antioxidant load in the Phytonutrient Multi is stronger and has a stronger push than what's in the A-Reds formula. So that covers your eyes. It's already built in. Then you got the B vitamins, you got other antioxidants built into it. Guys, you guys had fantastic questions today. That was wonderful. I so very much appreciate it. I'm looking through the chat just a little bit because somebody had put a couple of questions in there. Child has constipations onset about 2 months. GI docs just keep saying give fiber. Stomach will get huge and not poop for days. Has had episodes of vomiting. Suggestion for 6-year-old. I'm going to say schedule a consult. Absolutely. Yep. There's some things that we can do. One other question came in, and do you have recommendations for histamine intolerance? Yes, we do have a formula. We recently renamed this too. That does a great job for histamine. It's funny, I just came back from a conference about 3 weeks ago, and one of the speakers, one entire 2-hour block, was on histamine intolerance and histamine issues. So that really trickles down and affects a huge issue. DeoHist, I think DeoHist is what it's called. We've got it here at the pharmacy. If it's not in the online store, certainly just give us a shout out and we can get that sent to you and take care of that for you. But DeoHist and really kind of ramping that up as needed and watching the response to it, but works very well. All right, guys, I don't see any other questions in here. I do appreciate your attention today. Next, again, reminder, next month's webinar is April 12th, and that's on women's health. We'll be hitting a whole variety of issues there and give you a bunch of, hopefully, as we did today, tools for the tool bag, right? That's what I like, is some things that you realize. So maybe you're not having it right now, but maybe a friend, neighbor, relative has it, or, as we age, things tend to kind of creep up, right? So then you've got something that you can go to in your tool bag. And, I know it's on women's health, but I love it when guys are on the women's health webinars. So encourage your spouse, encourage your significant other, because the more we understand about what's going on with our partner, the better partner we are, right? It works for a great symbiotic relationship. So I'd love to see a ton of guys on the women's health next month. So until then, I hope everybody has a fantastic afternoon. Wonderful March as we kind of start heading into springtime. So until then, best of health to everybody. Have a wonderful afternoon. Thank you.